You have a runny nose, a cough, and congestion. So, have you caught a cold or is it allergies? Unfortunately, it's often hard to tell. Today, we have board-certified family medicine physician Dr. Jeff Nall here with us to give us more information about determining which it is and what will give us the relief we need. Dr. Nall, thanks for being here.
Thank you for inviting me, Jeff.
Well, I was able to spell your name correctly, but we're not related.
Not related, that's correct.
But welcome to Pensacola.
Well, thank you. I'm pleased to be here.
Well, I understand you've been here since September and you practice in Pace. Can you tell us a little bit about your take on family medicine and the practice?
Sure. I work in a small office with one other physician and 2 nurse practitioners. We see everybody from infancy to late elderly care, and we're happy to see everybody from a variety of issues, from acute issues to chronic issues and everything in between.
Okay, great. Everything in between is kind of where we fall today.
That's right.
So let's start off. So what exactly is a cold? Let's start with that one.
A cold is kind of a symptom, a bunch of things put together: cough, congestion, runny nose, usually caused by a virus. Most common cause is the rhinovirus. There are hundreds of rhinoviruses out there, and typically you only get one rhinovirus each time you get a cold. Every time you get a cold, the rhinovirus that you get is different. Therefore, you could have maybe 2 to 3 colds your entire life and not have the same cold every time.
Wow, okay. Well, allergies, we were talking earlier, there's already pollen and yellow stuff on the cars,
Unfortunately, yeah.
It's a little early in the season, so let's go ahead and get that out there. So let's talk about allergies. Well, how would you define an allergy as opposed to a cold?
So when we're talking about allergies in general, we're talking about allergic rhinitis or seasonal allergies, also called hay fever. Several names for the same thing, but basically it's a body's reaction to allergens and irritants that are in the air. That includes the pollen that we see around. That can also include mold, pet dander, and dust. Those are fairly common allergens.
So what are some clues that will help us determine which it is and maybe what medications we need to take or what we need to talk to a doctor or pharmacist about?
Sure. A cold is usually self-limited, usually lasts 10 days or less. The symptoms are fairly mild: the cough, congestion, fatigue, runny nose, but it can be hard to distinguish from the allergy symptoms, which also include runny nose, postnasal drip, sneezing, and cough. So sometimes those irritants that are associated with the allergies can be noticed, and if it is a reoccurring pattern, sometimes you can see that it's an allergy because of that.
Well, I guess the best thing is just to avoid them or prevent them. What are some things we can do to prevent both of these things?
Yeah, if a person notices that they have a predisposition to have these symptoms during certain times of the year, avoiding those irritants and allergens can be a big help. Sometimes using things like a HEPA filter within the home, or avoiding exposure through, not going outside during certain times of the year. With colds and flu season, keeping your hands washed, making sure you're not sharing cups and other things with other people is a really big way to prevent getting a cold.
Okay. Well, as a physician, what recommendations would you have specifically for older adults, or how more susceptible may they be? Talk about this population in regard to colds and allergies, if you don't mind.
Older adults tend to have more comorbidities like diabetes, hypertension, lung disease. Those are things that are commonly found. So people that get colds with those predispositions can have lengthened symptoms, increased frequency of getting those infections. Of course, if you're on multiple medications, you should always talk to your doctor before starting any over-the-counter treatments, because those over-the-counter treatments can interact with your chronic medication list.
Mm-hmm. Well, yes, that's always good to point out, because multiple medications may have adverse reactions. Mm-hmm. What do you recommend to someone who says, okay, I can get through this? At what point do they need to maybe consult someone like yourself?
Sure. Sometimes it's very difficult to kind of draw that line. If you have a chronic illness that already predisposes you to having, worse symptoms, it's not a bad idea to come in. Also, if you have a fever over 101 degrees Fahrenheit, if the symptoms seem to be also involve shortness of breath, chest pain, or anything worse than the symptoms we talked about, those are reasons you should probably consult your physician.
What do you hear from patients who suffer from these? Do we typically wait too long?
I think that it kind of goes both ways. Sometimes people will get the slightest bit of sniffle and then, come in for that. It's okay to wait a few days, use some over-the-counter medications that you've already discussed with your doctors being safe, and try to get over it on your own, because it could be a cold and it could be something you can get over. If you wait past the fever point and wait past the shortness of breath point, it can lead to worse symptoms. So there's kind of a fine line and balance in that.
Okay. Well, when you were talking about preventive measures, like pets and stuff, really there's some
hard.
things that are hard to control.
That's right.
What are there more realistic recommendations as far as like our home environment?
Sure, someone who has a strong allergy to a specific type of pet, of course you wouldn't want to give away Fluffy, that would be very sad. But keeping the pet out of the area where you sleep in typically can help a little bit. Also buying something like a HEPA filter to clear the air of that pet dander can help. And of course, if your allergies are bad enough, seeing an allergy specialist to get maybe injections to help you get used to that allergen can also help.
Well, I know this time of year we have some moderate temperatures. What about opening the windows? I know everybody likes fresh air, but is this something that some people might opt not to do?
Yeah, if you're prone to allergies to pollen, dust, things in the air, then yes, opening the windows can actually lead to worsening symptoms. So if you're prone to that, I would probably leave the windows shut, maybe turn the AC a little higher.
Okay, well that's all great information. It seems real simple to talk about colds and allergies, but it's something that we all unfortunately have to deal with. So thank you for that great information and recommendation. We'll be right back with more coming of age and an upcoming caregiver training and health fair.